It's like climbing a mountain. You don't know how far you've gotten until you look back and see how far you've come. My name is Dr. Gary Wiltz, and I have the honor of being the CEO of Teche Action Clinics, Louisiana's first community health center. And I'm hoping to tell you all a little bit about the story of how we started, where we are, and where we're going to be going in the future.
It was a very small beginning. It started in a little dental office down the street, and Dr. Musso, who was also our coroner at the time, was the first doctor there. I said, okay, we're up and going. Let's see where it goes. It was not real big during those first 10 years, and when Dr. Wiltz got there.
I think the secret to our success and longevity is the commitment of the people that started it and then continued it, starting with our board of directors. Community health centers, and for those that don't know it, we are unique in this country. 51% of the board of directors have to be consumers of the product.
This clinic began as a medical home for migrant, seasonal workers, and people who worked in the sugarcane industry. And beyond that, it has grown to the 14 sites we have now. It seemed like an important board to serve on. After all, it affects medical care for the whole community and communities beyond Franklin. Because I'm a patient, I'm much more aware of the barriers that present themselves to other patients, barriers that may be presented to me, as well as I'm able to affect the kind of treatment that I receive, and that other people receive, because I have been through it, and I can say at a board meeting, this is what happens when you come.
I feel as though Teche Action has been an anchor in the city of Franklin as far as healthcare concerns are. It has become a solid brand of solid health care to many citizens in Franklin, especially some of our underserved. As a matter of fact, Teche Action Clinic has had a major economic impact in the city of Franklin as being one of the largest employers in the city, in the heart of the city. Many of those employees live and reside within the corporate limits of the city of Franklin, so they're my constituents as well. So that's a major economic impact that Teche Action has had in the Franklin community, and I'm forever grateful that Teche Action is there.
We have a tremendous list of great collaborative partners that we've had through the years. We do clinical research with Tulane. We did a great partnership with in Houma with the Red Cross. That is one of only 12 in the nation where they provided a mobile unit for us. So we're able to go into the communities and go down the bayou, and service those folks.
Dr. Wilkes and the American Red Cross has put together what we call an enhancement to provide some services to enhance the ability of him, as far as a healthcare provider, to go ahead and provide that service with a mobile unit out to those communities. And that mobile unit now have the access to go to the community and provide mental health, behavioral health, dentistry, and medical services. So they're able to do that and address that need after disaster. A lot of time after a disaster, to be honest with you, a lot of people down the Bayou communities don't have access. So now that mobile unit could go to them. They don't have to come to the clinic.
I'd say in the last 20 years it exploded. We had the good fortune of having access to people like John Bell Edwards and Kathleen Blanco, and we were able to get lots of money to expand and build systems and all over the place in our district.
Medicaid expansion has been the greatest impact that we've had in the last 10 years. We went from having, in some of our communities, some of the clinics we had, 80% uninsured. 80% of the patients, when they would come in, we would means test them, sliding scale, they'd bring their proof of income, and they would pay $5 or $10 for a visit. That costs about $200. You can imagine 80% of the people coming in on that sliding scale. That applied across the board for dental services and the whole thing. Now we are less than 5% uninsured. So it made a tremendous difference.
I first got to meet Dr. Wiltz very early on in the administration. He has been one of the most active voices in this state for healthcare access. Teche, of course, has been that solid voice for 50 years now, the very first FQ in the state of Louisiana. I think federally qualified health centers are my healthcare heroes. They are our community leaders, and they allowed Louisiana to thrive in this new environment where finally our citizens have coverage.
As I mark the milestone of 50 years and look back and reflect, we have advanced the cause. I'm very optimistic. I'm very hopeful about the future for Teche Action Clinic and community health centers in general. So we still have things on the table that's going to enhance what we're going to be doing in the future. And I hope to be a part of it for as long as I can. I'd like to close by wishing everyone to join us in celebrating 50 golden years. It's really been a tremendous pleasure, honor, and opportunity. And I hope the Lord continues to bless us to have another 50 years.
In this half century of service, I congratulate you for this incredible impact you've had on your community and of the state overall.
Thank you for 50 years of providing equitable healthcare services to Terrebonne Parish.
Wow, congratulations to all employees and all providers at Teche Action Clinic.
Congratulations to Teche Action Clinic on your 50-year anniversary.
It's been an amazing ride, and it ain't done yet.